Hello, we'll be talking about something actually called medical trade interactions. It's actually a beautiful thing actually that actually tells about some special things like medical, and it tells about DTI. That is a double trade interactions. We can see definitely in this plane definitely we have the medical trade interactions here. We have the trade interactions here, and the trade interactions are actually the doctors. These are the doctors. So, for example, if you actually looking for a doctor, definitely you have to install this program, and then it will pop up like this, and then you have to type something here, the condition of your health. And after typing the condition of your health, then this will pop up definitely, and it shows the diagnostic, what is wrong with you, and the computer will also show something. And then there will be a correlation, the correlations between these two, between the trade interactions of the doctor and the case study of the computer. And if any of them matches properly, then a recommendation is sent to the patient, and the patient can strike that. And once the patient strikes that, definitely then there will be a conversation, a chat conversation, like live chat, like email, call, SMS, radio, all that. And we'll have the doctor, the patient, the clinic, and the prescriptions out here, definitely. So for example, you know the doctor now by the interactions, by clicking, by the recommendations, you know the doctors definitely, and then you can chat with the doctor. And after chatting with the doctor, if actually it goes well with you, definitely they will definitely recommend you to come to the clinic for tests or other things, and they might do pathway medical to be able to check some things, definitely, like actually knowing about your state of health. And after knowing about your state of health, they can prescribe and do so many other things. So it's beautiful like this. And when we have the patient profile, this is the patient profile that installed the program, and this is the patient private doctor, the telephone of the private doctor, and the chat email of the private doctor, the patient history database, what the patient has formally in his database, and upload database. Upload database, we have add history database. That means definitely that the patient can type in here and tell about his history, his medical history. He can type his medical history here. And once he types his medical history here, this will definitely try to help the case study, that's the computer case study, by giving in a database to the computer. And that database definitely might be human, but it's actually computerized, and it's a database, definitely. It sounds like an AI, definitely, because random samplings of decisions can come out of that. So based on all this, definitely. So once it types the condition into it, this starts working. The computer starts working, and once it correlates with the doctor, it pops out something, definitely. It pops out a chat position, and you can chat with them. And after chatting with them, definitely, if it's good, definitely, through your pathway medical, they can give you prescriptions. And if they can't give you prescriptions, they will ask you to come to the clinic. And this is done by your AI. And you can rewind, you can stop, you can play, you can record, you can fast forward, and you can loop. Beautiful. We have 5 template clinic diagnostic, AI restrictive. AI restrictive is that there are some files that are restrictive that you don't have to get into. Add create, then you can add create, you can add history database to it, so that your record will be well founded and your diagnostic will be proper. And then we have trade interactions. These are the trade interactions, definitely, from the doctors. The doctors are actually and I immediately you send your conditions in, and it goes to the computer, and the computer can assess your conditions. It correlates with the doctors actually there of the database. Is definitely, it ranks them. After it ranks them, definitely you see them, there tends to be a participation and interactions, and after these interactions, prescriptions and some other things will be given. So it's beautiful. We have phone chats and therapy. Therapy can also take place through this. A psychological doctor definitely, or a psychiatrist definitely, can actually give a therapy, or a psychotherapist can also give a therapy. And it's beautiful definitely that all these are actually working for the medical trade interactions. That means typing in my condition and then correlating with the computer, then correlating with the trade interactions with the database of the doctors, phoning the doctors or giving a chat with the doctors, and the doctors giving a chat back, and then my system actually correlating with both of the doctor and the case study, the computer, and then we can have a good understanding about my diagnosis. Then I can be treated, giving prescriptions or therapies. If those things are not possible, then I will be invited into the clinic for more intensive care. So this is all that we have. Beautiful. Good. Bye.